name's Christopher Hurt, and I'm an assistant professor in the Division of Infectious Diseases at the University of North Carolina at Chapel Hill. And Dr. Wall and the folks from NCATEC asked me to talk to you a little bit about PrEP, or pre-exposure prophylaxis. This is a topic that's gotten a lot of interest, and there's a lot of questions that are out there about PrEP. And so I think this is a good time to start talking about it and kind of get people to be more familiar with what PrEP actually means. So we've known for a long time that you can use HIV medications, antiretroviral medicines, to prevent you from getting an infection after an exposure. So that's post-exposure prophylaxis, or PEP. So the idea behind PrEP is, why not take those medications beforehand? So you have the drugs up in your system at an adequate level by the time that you have an exposure of some kind. And so there were a bunch of studies that were launched over the past several years. And as of January of this year, of 2014, there have been 6 major studies that have been reported in the literature. 4 of those have been successful, and those studies were called iPrEx, Partners PrEP, TDF2, and the Bangkok Tenofovir study. And all of those studies looked at either tenofovir or Viriad by itself, or the combination pill of tenofovir and emtricitabine, which most people call Truvada. It's better known as Truvada. Those studies were successful. It showed that if you do take the medication as an HIV uninfected person before an exposure, it can substantially reduce your risk of acquiring HIV. There were 6 studies, though, and the other 2 were unsuccessful. Those studies were called FEM-PrEP and VOICE. Those studies were done in Africa, and those studies focused mainly on women. And those showed actually there was no effect to taking either tenofovir or Truvada before an exposure. So the reason for that difference is, and why the 2 studies were unsuccessful and the 4 were, really comes down to a consistent theme through all of the studies, which is that these medications, just like we tell our patients with HIV, they don't do any good if they're in the bottle. So unless you take them on a consistent basis, there's no protective effect. And we saw in the successful studies that the amount of adherence, the better you were at sticking to it and taking the medications every day, the higher the level of protective effect. In FEM-PrEP and VOICE, the 2 unsuccessful studies, it turns out for whatever reason, the women that were enrolled in those studies said that they were taking the medications and actually weren't. So and there's a lot of research going on now to try to figure out why that happened. So based on those data, in July of 2012, the FDA approved Truvada for use as PrEP, and that's for both heterosexual men and women and men with sex with men. And they felt that the data was compelling enough and strong enough that it was an appropriate indication for Truvada. Since then, though, the uptake has been really slow, and that there's been a lot of questions about why that is. I think there's a lot of reluctance on the part of patients who may not be willing to talk to a primary care provider or a family doctor about their sexual risk behavior. There's reluctance on the part of providers who don't really know a lot or enough about PrEP, or they don't know enough about how to check sexual risk history or what the indications would be for PrEP. And there's also lingering questions about how to pay for the medication. There are patient assistance programs for some people. There are questions about whether or not Medicaid is going to cover it or other insurance is going to cover it, even though it's FDA approved. So there's still a lot of gray area out there about PrEP. The CDC has tried to help with this by issuing some interim guidance that gives some general support and decision-making tools for how to use PrEP and how to prescribe it. That includes the kinds of tests that you need to order beforehand, the frequency of monitoring for HIV after somebody's on PrEP, testing for other STDs, and so forth. The main thing with those guidelines is that they recommend testing about every 3 months, so giving a 90-day prescription and testing every 3 months. I personally think that's a little bit too long, and I would favor doing testing every month and not every 3 months. Resistance, if you become infected and you're on just Truvada, resistance to Truvada can develop within just a couple of weeks. So it's really important to know if somebody has infection and to do testing that's capable of detecting acute HIV infection. So that's basically PrEP in a nutshell. We at UNC are happy to try to help with decision about which patients might be appropriate. And I know that NCATech would be willing to kind of help connect your questions to providers here at UNC for us to try to answer. That's it about PrEP. Thanks.